Hi there, this is Ashley Jones doing my N408 reflection from the term. So to answer question one, what are my feelings and thoughts regarding my community as a patient? And I really would have to say it's pretty indifferent or neutral. I've always had the privilege of being able to go to Billings, which is about an hour away, to get all of my healthcare needs taken care of, with the exception of the emergency room visits, which I tended to, go to my local hospital because it was right there. But as a whole, I love my community. It's a tight-knit community, but my feelings have definitely changed towards the access to healthcare because there are some people that I know who do not have that privilege of being able to just hop in the car and go to Billings for their healthcare needs. And so I've never really had to think about it before. I've just always thought it wasn't a big deal, but for some people it can. And so I think access to healthcare in our community and the limited care that is available can be a big deal to some people who can't necessarily afford it. So number two, have my feelings changed towards the community? Again, as a whole, no, but as far as access to healthcare and the care that is provided, absolutely. I've never really had to sit and think about it before. I've always just had the financial means and the transportation to get to Billings for anything outside of emergency room care or, sports physical exams. I've always been able to go to Billings, but there are people who can't. And so as a whole, about my community, no, my feelings are the same, but definitely for care that's available in Muscle County, my feelings have definitely changed towards that, and I feel like something could be done or should be done that could possibly provide more care to the citizens that can't necessarily afford to get to Billings for that care. So number three, what new information that I have learned, and I would have to say that I was shocked to hear that 31% of the STDs reported in Montana come from Muscle County, and I think that that is so significant because Muscle County's population is less than 3,000. I got this information from the Montana Department of Public Health and Human Services, but for a population less than 3,000 compared to the entire population of Montana, 31% is big. And again, I feel like that could go back to access to care. People who might have an STD, can they afford to get to Billings? Maybe not. Again, education in the schools, maybe it's not great when it comes to sexual health. Yeah, I think that this access to healthcare and the care that's provided is just kind of this big cycle that could be somewhat detrimental to families who can't afford to get in the car and drive a minimum of an hour, depending on where they're at in the county, to get care that they need. And to answer the last question, one problem that I've identified, again, goes back to access to healthcare. And maternity, OB, is my passion, and there is not any access to OB, prenatal, postnatal care. And so those patients who cannot afford to get to Billings, they might not go to their prenatal appointments. Therefore, they could have, poor outcomes, birth and, postpartum depression. Are they being screened for it because they're not going to their appointments? Who knows? And so I think it would be awesome to create an outreach clinic in Muscle County once I become a midwife and go up there a couple times a month and do prenatal appointments and come back for their 6-week postpartum appointments. I'm kind of dreaming big and I'm excited about this, but I feel like it could be really great for the community and for the people who can't necessarily afford to get in the car and drive to Billings. So I'm excited for next term. This term has been awesome. I've learned a ton about community health and especially my community, and thank you so much for a good term.